Yeah, I'm a dental hygienist. I've been a dental hygienist now for 37 years. And I was the first male graduate from the University of Medicine and Dentistry, now Rutgers Dental. I was the first male hire at New York University, one of the first licensed in the state of New York. Well, I'm a holistic hygienist because I work for a holistic dentist. And what the holistic dentist means that we use biocompatible materials. We don't do mercury fillings. We consider the body as a unit. We have a multidisciplinary approach at treating the patient. So we look at other things, not just your teeth. I appreciate that I have been in that practice. I've worked in other practices, but I've been in that practice for 35 years because I've grown with my patients. I've actually literally grown up with them. What I find really interesting, and I'm so glad to have this platform to even share it, is that when you look at your mouth differently, when you look at what's the cause of what's going on, you can control it differently. You don't always need to do that. Now, if it broke, you know you gotta fix it. But there's still some basic maintenance things and there's some control. For example, the enemy in the mouth is acid and bacteria. If the acid is out of control and the bacteria is out of control, then the house is gonna fall. I don't care, the house is just gonna fall. So if you can control the acid and you can control the bacteria, you can put a grip on things until you can either figure out how well you want to renovate or to what degree you need to renovate, you know, what's going on in there. I am back in private practice and seeing patients and booked till September, and I've been back for about a month now. It is safe to come into the office. In my operatory, I have an air purifier. I'm masked up like I'm going out to get bees or something. A lot of the precautions that the dental hygienists use, we've always used. Way back since in the height of the AIDS crisis, we were one of the high risk professions. So we went and did a whole bunch of covering and stuff, and we've been covering up forever. But it's equally important to understand that the way that the virus is attacking us, so that we are being told, and by scientists, is through the nose and out the mouth. And it's the reason for the covering. So if it's through the nose and out the mouth, we can really control this with some simple things. I came prepared, Angela, because I know you like me to be prepared. Very simple. Coconut oil. Coconut oil. A teaspoon of it in a glass of hot water, as hot as you can stand it. As hot as you can stand it. Teaspoon or two of coconut oil. Stir that around. Discard it. Now, as simple as that was, what I just did was I covered every surface in my mouth with an antiviral. And what are we dealing with? The virus. Antibacterial, antioxidant. Coconut oil is. So now you have covered everything. If you have crowns, you've covered the margins of your restorations. If you have cosmetic stuff, you've covered all the margins and borders. And because it's an oil, it'll help dissipate stain. You can do the coconut oil straight by itself, oil pulling, which is a Ayurvedic technique. So with the water, it allows you to be able to spit it into the sink. The holding it and the protruding, that's an Ayurvedic way of mouth rinse. It's a different way of rinsing your mouth. And so it allows you to stretch out the tissues on the inside. It's great for us singers and actors. It's great for us to get all of that, because what you're doing with the hot water is opening up your pores so that this coconut oil can permeate, and it is an antiviral, antibacterial, antioxidant, pulling toxins, spitting it out. For the children, for children, it's great to get them used to that. You're going to tell them that you're not just brushing your teeth, you're washing your mouth. And for us as adults, as we're doing this, we're stimulating blood flow, washing all these places that we never wash, and then you rinse with the coconut. If the child, you think the coconut rinse might be too much, you can put it on a cloth, a white cloth, and that's also for adults you can do to wipe your tongue. Now you have COVID cleared anything coming out this mug. You're supposed to clean it, and people do it that way. I find it equally effective, and definitely with the coconut oil on the cloth, to just go like this. Now, if your gums were like inflamed, swollen, you had whatever, this, that, the other thing, something's going on back here. You know what I'm saying? Dude, with the same coconut oil, if you keep it in the fridge, it'll start to coagulate, so it'll have a thicker consistency. You can get some clove oil, like a little drop of clove oil, great for the teething children. Put a drop of that on a Q-tip and dip it in and rub it on whatever the spot is. The mouth is an internal, external organ. The teeth are external, the soft tissue is internal. So you're treating the internal and external organ by doing that. You also want to ingest something. You want to boost your immune system. If you have an infection, if you feel like you got like the gums are swollen, and that means that an infection is starting and there's an imbalance, you can take turmeric. These are the natural things that you can do. Of course, you can do other things, but these are natural things. So you can take turmeric to boost your immune system. You can take oregano drops under the tongue to boost your immune system. Oregano can be harsh, so you would want to do that in like a season, like a stretch, like 4 days and then rest, or 7 days and then rest. But turmeric you can ingest. To control the acid in your mouth, you can simply take some ginger and make some ginger tea with the coconut in it and do the same swish and enjoy it. Ginger is a natural pH neutralizer. Ginger water does the same thing when you digest it. It neutralizes the acids. A lot of people are doing the lift. It's good to do internally. It's horrific on your teeth. So if you're going to do the ginger, if you're going to do the lemon water, you definitely need to swish with some ginger water afterwards. Conventionally, well, you don't want to have any sort of mouthwash that has alcohol in it. The purpose of the fluoride is to coat the teeth and to neutralize the acid effects on the enamel. The coconut is doing the same thing with a little ginger water, particularly if the child is being inspired to wash their mouth and not just merely focus on their teeth. And you'll see the difference in how they are aware of their teeth, because they're touching the entire mouth. They'll know when they're coming in, when the tooth is coming in and it's sore. They'll put the clove with the coconut on it, and they'll see how it numbs it, because clove has the numbing ingredient that ambisol has. It also is a further antiseptic. But prior to that, you want to play dentist with them, because one of the most stressful experiences for a child is having someone invade their space. You are the sunshine of my life. That's why I'll always be around you.